So you're going to have your radioactive iodine i131 treatment. So a week or two before you start your treatment, your doctor might put you on a low or no iodine diet, or you can get a thyrogen shot. In my case, I got 2 weeks to prepare with my low iodine diet, and I still got my thyrogen shot. So this is a list coming up of things you can eat versus things you shouldn't eat while you prepare for your treatment. It can be difficult, but all you have to do is meal prep and meal planning. I had to make up stuff, and this is one of my meals that I did. It's some pasta with veggies. I131 treatment, it's just a small capsule that you swallow, and you stay isolated for 5 to 7 days. Post that treatment, you'll have a thyroid ablation scan from your head to toe. It's like a CAT scan. They scan to make sure that the radioactive iodine was absorbed. There's a few precautions you should take when you get radioactive iodine. The first thing I was told was don't travel for a week. I wanted to travel a week or two after I had mine. My doctor advised me not to travel because you could trigger radioactive alarms at the airport. Imagine you traveling through the airport with high levels of radioactive iodine and triggering off an alarm. I haven't heard of cases where that happened, but I wasn't looking, and they told me to avoid traveling for a week after. Number 2, practice good hygiene. No, sharing bathrooms isn't ideal, but if you do have to share bathrooms, make sure you spray the toilets, wash the sink each time you use it, because the radioactive iodine is secreted in your sweat and your body fluids. So third thing to do is avoid sexual contact, because face it, you'll radiate your partner. So no sexual contact, hygiene with the bathroom, and no co-sleeping with your partner or infants is a good way to start. You get nauseous during the first week or two after taking your radioactive iodine. You get inflammation and swelling at the site where you had thyroidectomy, or just swelling of the neck if you have hyperthyroidism. Short-term side effects of radioactive iodine: taste buds. You have a change in your taste right off the bat. You get inflammation in your salivary gland. I got inflammation in my salivary gland a year after my I-131, and it's still ongoing. Dry mouth. You also need to drink a lot of water, a lot of fluids during your I-131, and you're advised to do the same continuously. Keep hydrated, drink a lot of water to flush your system out for at least 6 months, and take a lot of sour candy to stimulate salivary glands. Long-term side effects: inflamed salivary glands. I had huge swellings like the size of a lemon on the side of my face for a few months. It changed sides frequently. The next thing, you might have dry eyes or watery eyes, dry mouth for long term. You are usually tired. That's a long-term side effect. You're feeling tired all the time. Anemia is a long-term side effect. And secondary cancers, which I already had. Lung problems and infertility are two main long-term side effects of getting thyroid treatment. 3 months to 6 months after your treatment, your doctor will follow up with a neck ultrasound to check if you have swollen lymph nodes and to check if there's any inflammation that might suggest that you have metastases or spreading of those cancer cells. The doctor might also order a PET scan to see if there are other areas in your body which flag for cancer cells. Thanks for watching. Remember to like, subscribe, and share.